Alright, the last part of the vertebral column, and it's down at the bottom. This would be like in the back of the pelvis that I'll show you. One from class that I have. So here, this is called the sacrum. And you can see the sacrum is going to articulate with the lumbar vertebrae right there. Right there. So the sacrum is actually made of 4 fused vertebrae, and you can sort of see little bumps here that make up those 4 fused vertebrae. These would have been spinous processes, but they're not called that anymore. Like they were on here. You can see the size of these suckers too. Look at that spinous process on the lumbar vertebrae are pretty huge. So again, the last part of the vertebral column, these have been fused together over evolutionary time. For what purpose, I couldn't really tell you, to be honest. I'm going to have to do some more research on that. We have a few things here. One, at the top, there's a space where the spinal cord comes in. That's called the sacral canal. And so, again, just like the vertebral canal, there's holes, and the nerve tissue comes in here, and then it just sort of starts fanning out through all these other holes, which are called Sacral Foramina, the smaller holes that are part of the fused vertebrae here. These are called spinous tubercles. You can see they're not really spinous processes. They would be if they were on another vertebrae, like separate. These are called the tubercles. They're kind of like spinous processes, but they're not. And then we also have at the bottom here, the hole where some nerve tissue can come out is called the Sacral Hiatus. There's just a little gap down here at the bottom. What we don't have on the skeletons that I found, I only found 1 sacrum. What we don't have is the coccyx, which is actually the tailbone, which are, again, fused vertebrae as well. So, I guess, oh, sorry, guys, there's 5, sorry. For the sacrum is 5 fused vertebrae. I don't know what I was thinking. I can even count them here. 1, 2, 3, 4, 5 at the bottom. Sorry, 5 fused vertebrae for the sacrum. And you can even count the holes that would be in between each one. So 4 holes in between each. Sorry, guys. I don't know. It's probably because it's 3 o'clock in the morning and I'm freaked out looking at somebody's skeleton and trying to avoid getting in trouble with this. So, but anyways, so that is the vertebral column. Oh, I told you I was going to show you the thoracic cage on my example from class that I brought. So you can see how the ribs, they have, the thoracic vertebrae have these facets here on the back that are going to hook up with the ribs, and then the ribs come around to the front that are going to articulate with the rib cage. There's actually the sternum here and the cartilage. And we're going to do that in just a second. Alright, we're going to do the thoracic cage, and again, really the only thing I have that I found were just a couple of ribs scattered among the brush, and I don't know, I suppose they might be out there, but I'm not interested in going in there right now to look for them. Can you guys hear that goose? 2 of them, I think, flying over my head. That's a perfect symbol for get out of here, but oh well, I'm staying. So anyways, here we have 12 pairs of ribs. We have the sternum, which is actually has 3 parts to it. You'll see, again, going back to the ribs that we talked about from the vertebral column, they come up here, attached to the cartilage here, which is called Costal Cartilage. Comes up and connects with the sternum here. And again, the sternum is made of 3 parts. We'll take a look at that. There's different types of ribs. We have true ribs, which there are that make up the first 7. You can see here the first 7 ribs. They're all connected to cartilage. And then we also have false ribs, which are down here at the bottom. They are not connected to their own cartilage. You see they sort of all share a cartilage here, costal cartilage. So these last 4 ribs are called false ribs because they're all sharing a costal cartilage kind of to go into the sternum here. And then we also have floating ribs, which typically are the last 2 or 3 ribs. Oops, sorry. And you can see on there the last 2 ribs that do not connect right here with costal cartilage. So they don't make their way up to the front. and connect here. They just end right there, which is kind of odd, and they can be broken quite easily because of that, because they're not connected all the way around. This cartilage is really flexible. If you were ever giving CPR to someone, you're giving chest compressions, this cartilage can give quite a bit, and they tell you to push really hard, and if you break a rib, it's better than not saving the person's life. So if you ever give compressions for CPR, make sure you push really hard. That's going to give quite a bit. The bones, you can see, will move with it. So anyways, back to the sternum. This is a really hard protective, sort of like a shield for your heart and lungs, the important parts underneath. There's 3 parts to the sternum. The top part, which is basically right up here, is the Manubrium. The body of the sternum is all this right here. Sorry, that was all that right there. And then this last little tip is called the Xiphoid process, and it's a process. It sticks out, and so this is attachment for other things underneath, abdominal muscles and such. And so, let's see, I have somewhere over here, there we go. I'm going to leave this close by. Oh, I forgot part of the vertebral column video. We could have put this in there. This is really odd to find this, actually. It's called the hyoid bone. And actually, it's the only bone in the whole body. I'm surprised I found it. The only bone in the whole body that doesn't articulate with another bone. So basically, it sits right here, and if you feel on your neck, let me see if I can do this for you guys. If you feel right here on your neck when you talk, there's a part that goes up and down. That's your hyoid bone right there. And again, you can go in there and feel it. It doesn't articulate with other bones, which is the only bone that doesn't articulate with other bone. It articulates with muscle, and so it's called distant articulation. It's articulating only with muscle and not other bones. The only bone in the body that does it. All right, so here we've got what I found up here. This would be the right scapula. All right, and this would be I believe the clavicle that went with it. And so let's go over some of the scapula stuff. We have a few different parts that you want to know for the scapula. First of all, this is just like the body of the scapula. All right, so this is there's actually muscles that sit in behind here, sitting up here. We'll talk about those in the muscular unit coming up soon. We have a couple things on the scapula that we need to point out, and one of them, if you feel your shoulder like right there, you should have a point on your shoulder. You feel that? Most people have a nice point there. That's the Acromion process, which is right here, and that's what's going to articulate with the clavicle. And so let me see if I can show you how this would line up here. There's a little spot for it to attach, just like that. So you can see it up there on that one a little bit, but that one's all screwed in and kind of looks weird because of that. So that's how the scapula and clavicle attach right there. The Acromion process right here. We also have the Coracoid process, which is in the front. I don't know if you can tell. Yeah, you can tell this is the front right here of the right. This would be the right arm right here. I'll put that in there a second. The Coracoid process is attachment for muscles to move the arm, to attach, kind of make up the shoulder. We also have what's called the Glenoid fossa, which is, you can see this sort of like little concave surface. That's where the head of the humerus is going to fill in, and we'll see that in just a second. The clavicle, where's my clavicle? The clavicle, which I guess would be more like that. I'm just going to lay it out how it would be sitting up there, attached to the Acromion process. The clavicle's got a few pieces, but really nothing that we're going to focus too much attention on. Some little parts where muscles attach. The point of the clavicle is actually to help hold the scapula in place. You can see it attaches here to the Manubrium of the sternum. I can't show you down there, but attaches there to the Manubrium of the sternum, and then attaches to the clavicle, to the scapula at the Acromion process. And then the scapula does not attach in the back. Besides to muscle. So this has got a lot of movement for your shoulder, for your arm to move. And we all know what that's like because we can do those things. Throw a ball overhead and shoot a basketball and stuff. Alright, let's get to the humerus, which would sit right in here. The glenoid fossa. Alright, this doesn't make it fit perfectly, but you get the idea. Here's the humerus. Again, this is your upper arm, your biceps brachii would fit right in here, triceps brachii back there. Here's the head of the humerus that fits in with the glenoid fossa. We also have these epicondyles at the bottom. This would be obviously the right arm again, so this is medial epicondyle and lateral epicondyle. And this is going to articulate radius and ulna down here. I'll try to fit in for you, but it's not really easy. Oh man, these are a little bit slimy. Some animal wasn't finished with that. Alright, so that's what it should look like. Let me zoom out a little bit for you. That's what it should look like right there. That's freaky. I can hear coyotes. You guys probably can't hear that, but there's coyotes off in the distance. Those are not dogs. There's a whole pack of them. Must be in the cornfield across 72. That's freaky. Anyways, let's get this done. So humerus right here has at the bottom, this is going to form the elbow. So radius and ulna would come up like this and articulate that way. Our radius is on the thumb side, the outside. There go some more geese. Can't see them, but you can hear them, I'm sure. Hopefully they're not killer geese. They sound like they want a piece of me though. So anyways, radius out here on the outside. It's gonna, the thumb would be out here. We have ulna on the inside, and you can see how that fits in. How that fits in with the humerus up there. There's actually a lot of parts here to all of these bones, but anyways, this is called the trochlear notch. That's gonna fit in. I'm gonna get pooped on. All these geese. The trochlear notch is gonna fit in right there with the epicondyle of the humerus to be able to articulate there. At the bottom, we have some other things. We have a styloid process of each of these bones. Here's medial and lateral styloid process for each bone. You can see how this thing rotates. If you were to rotate your forearm, that gives you an idea of how, if you were to pronate and supinate, going back to your joint movements, that's how that works. Right there. This is the radial tuberosity, and it sticks out a little bit. You can kind of see there. It's a little bump. Again, that's our attachment for muscles for the forearm. And I think, yeah, that pretty much is it for, I can't think of anything else, for the thoracic cage and pectoral girdle. Pectoral meaning obviously the chest area, pectoral girdle. Girdle meaning it's holding in place, and what it's holding in place is parts to make up the arm. Alright, I got 2 minutes left on my camera battery, and we need to do the legs, so I'm going to flip over to my other camera. Alright, so that's thoracic cage and pectoral girdle.